On this edition of the Best Docs Network featuring Forest Park Medical Center, Dr. John Dulemba, Dr. James Davidson, Dr. Peter Baek, Dr. Jeff Angobaldo.
And hi again, everyone. Jim Knox along with Candace Kruger, and welcome back to another edition of the Best Docs Network featuring Forest Park Medical Center, which of course is one of the top medical centers in the entire Dallas-Fort Worth area. And Candace, Forest Park Medical Center now has a new addition where it helps individuals suffering from gastric reflux disease.
That's right. They continue their dedication to caring for people's needs. And of course, a lot of people suffer from gastric reflux, but Dr. Glenn Eide is there to help.
What we found is that there's a new technology for treating reflux that can get people off of their medications. The problem is, because surgery hasn't been used in 20 years or so, we didn't have a good way to evaluate the patients. Those centers were spread out throughout the state, frankly, and we decided that there was a need to have a center put together that could do all the different types of diagnostics that we need to identify reflux patients. Forest Park stepped up to the plate. They bought all the equipment. We got associated with some of the gastroenterologists in town that we hadn't done any work with before, and they've taken the lead to run the center, to do the diagnostics, and to give us the information we need to appropriately treat the patients. We do pH studies. We do pressure studies of the esophagus called manometry. We also do regular endoscopy to look and obtain pathology specimens. And the best test that we have now is called impedance. Impedance is a test in which we're able to actually measure the movement of fluid up and down the esophagus. So where the fluid may not show up in some of the other tests, for sure it's going to show up in this test. The difficulty that we had in the past was we were sending patients one place to get pH, another place to get manometry. We had to send patients down to Houston to get impedance. And so now having all that equipment in one space becomes very convenient for the patient. I think because there's so much information out there on the internet, on the TV, people understand that they have a problem. They have reflux, but they don't understand all the options that are available. When they come in to see me, I'm going to talk about their symptoms, how they relate to reflux, whether it may be due to some other disease process. We're going to talk about the anatomy. We're going to illustrate the anatomy to them in pictures. And then we're going to talk about the different tests that we need to do to confirm that this is actually what we're dealing with. And then we'll talk about surgery if it's indicated. And rather than having to send patients across the state to get that study done, it's something that we could do right here in Forest Park, Dallas.
When I first met Dr. Aldrich, I had come to him because I was having extreme knee problems. Being a horse trainer and being with horses all my life, I had pretty much worn out my right knee.
Lori was one of those patients that was on the younger spectrum, age-wise, for replacement. I think she was probably right around 50. You know, she was quite hesitant because she works a lot with horses, and I remember we had a long discussion, you know, will I be able to get back up on my horse? Will I be able to? And I said, I certainly expect you to. That's going to be our goal, is to get you back to your normal level of function.
He was trying to get people to work into a younger frame of mind to do this extreme surgery. You can be in your 40s and you can have a knee that's not going to take you any further. He brought to me the titanium gender knee replacement. I said, go for it. I said, I'm done with this. I want to get back to my life.
There's some differing opinions out there about whether there's a significant advantage to using a gender-specific knee. However, there is really no disagreement about the fact that there are some differences between the way the femur, the thigh bone, is shaped, and that has been incorporated into the design of, these are gender-specific implants.
The therapy after the surgery is extremely important. You need to get up and get moving, and I was really determined to make the most of this. And it was totally up to you of how much range and how much motion you got back from the surgery.
There is a significant amount of time until you're completely healed. They have to be ready to do their rehab and really work hard. I tell people expect it to be 3 months until you feel like you're really glad you did it, and probably 6 months to a year until you feel like it's a totally normal, natural knee. On the flip side, they're up and moving right away, because that's going to prevent bad things from happening, like blood clots and pneumonias and things that used to happen a lot are much rarer now because of the way we get people moving quickly right after the surgery.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way. Did you know Forest Park Medical Centers utilize a paging system similar to those found in many restaurants today? The paging system notifies patients' family members as to their location and status while undergoing surgery at Forest Park. The system also allows the surgeon to contact the family members to update them on their loved one's surgery.
I just decided that in my 30s I was not going to be fat and I needed a little help. Literally, it took me 3 years to get up to that moment. I've been putting it off because I work in a hospital. I don't want to be a patient there.
Bypass is restrictive and malabsorptive. It's restrictive in that we make the stomach small. We make a small pouch from their stomach. The remaining portion of their stomach stays in their abdomen. Don't change the blood supply, don't change the nerve supply, so it doesn't shrivel up and it doesn't die, it doesn't go away. And we then reroute their small bowel, and that's the malabsorptive part.
Which is a little bit better than, for me, long-term weight goals. Slow process in the beginning, but overall, it'll all come down.
I think the bypass probably is going to offer the most weight loss and the most sustained weight loss. And in particular, it's the only bariatric procedure right now that we have long-term studies that show it'll help resolve hypertension, diabetes, symptoms of reflux disease, as well as a myriad of other health problems that people get whenever they are overweight and obese.
At the end of the day, she will have you to where you are aware of what you're getting ready to do, you understand the procedure, and you feel safe. With my surgery, she said, today is the big day. Are you ready? I am. Let's do it.
When I saw her 1 week after surgery, she was already down 16 to 18 pounds. We'll see her again for her 1 month follow-up, and I think that she'll probably be down another 15 to 20 pounds. She's having a really good outcome.
When I seen her for my follow-up visit, I couldn't do nothing but say, Dr. Hodges, give me a hug. And I gave her a high five. So she asked me how I was feeling. I told her how I was feeling. No problems. She told me to take it easy, and she was proud of me.
Forest Park Medical Center, of course, is one of the premier medical centers in all of Dallas-Fort Worth. Now let's check in with one of their premier doctors, is gynecologist Dr. John Dulemba.
Adhesions are the normal healing process of our body. If you get cut anywhere on your body, you develop scar tissue. You develop that same scar tissue on the inside of your abdomen, but what can happen then is that scar tissue then can cause organs to stick to each other. So the ovaries can be stuck to the pelvic sidewall or stuck to the uterus. The bowel can be stuck to the back of the uterus. So with all of this can contribute to some of the pain that women experience, especially with infections or endometriosis. And until you get the endometriosis out, those scar tissue is going to continue to grow. It's going to continue to interfere with their normal functions. 60% of bowel obstruction are from scar tissue and adhesions. So yes, this can be a bad problem. They usually start off slowly growing, and then they get thicker, they get their own blood supply, their own nerve system, and they hurt as time goes on, as this disease progresses. So if endometriosis is the culprit that has initiated the growth of these adhesions, we have to go in and cut those adhesions, because they cannot go away on their own. The less blood loss that you have, then the less tissue damage, any of that can help prevent adhesion recurrence. But it still can recur in over 80% of patients that have already had adhesions in the past. If left untreated, the pain may continue to get worse. So the key is you cut them out. The problem is you've now cut tissue, you have raw surfaces, more adhesions. So there are things that we do to try and prevent these adhesions from coming back. One is we use barriers. We put tissue down or different types of material to try and keep those raw surfaces apart. And unfortunately, other than maybe trying things like acupuncture or alternative methods, physical therapy, anything to try and help relieve the symptoms, there's really not many alternatives other than surgery and trying to prevent the regrowth.
I assess patients based on their nutritional needs, if they are at nutritional risk, if I need to do any kind of intervention as far as medical nutrition therapy, which is prescribing certain diets. For example, if a patient has diabetes, then we would order a diabetic, heart-healthy diet so that it would fit into their meal pattern to help control their blood sugars while they're here at the hospital.
Having a culinary team in place definitely gives us an avenue to provide great meals. We feature anything from gourmet pizzas to ready-made salads to order. Everything's prepared fresh right in front of your eyes, and we try to do that in a timely manner.
Forest Park Frisco Cafe Services incorporate patient and family members into our dining experience. So if there's something available down in the cafe that is not on our written menus that a patient can select from, it's still an option that a patient can receive those items from the cafe directly onto a tray up to a patient room.
With Krista, we follow a pretty strict menu that we put out of the back, but then there's also special people with allergies or people that can only have certain things. We're a small enough hospital that they really get a personal care. She touches the patient every day. She brings down the information to us, and we take care of whatever culinary needs they have.
We have people from Frisco City Hall that come and frequent our dining establishment quite often, and they let us know how well we're doing. And I thought it was pretty unique to have people walk down the street, come into this facility. They're not patients, and they don't have any family members here at the hospital, but they just want to try us out because they've heard from other staff members that work with them of how good the food is.
Our menu is not typical hospital fare. It has a lot of, I'd say, Texas twist to it. It's anything from fine dining up in the doctor's lounge to some of the caterings that we do for the doctors. And then down here, we try to do things a little more regional, use some of the local produce, try to make it more of a resort-like setting.
Food and nutrition is a lot about lifestyle changes and lifestyle behaviors, and those things don't happen overnight. So what little coaching that I do get to give patients here in the hospital is mostly through a paper that they can take home with them and do some extra research on it. We try to give contact information for the dietitians as well, so if they have questions post-op, there's always someone available or some kind of way to get the extra information that they may need.
For the last 25 years, I have taken care of everybody but myself, and I have 3 children, had them very young, and I haven't really had an opportunity to take care of myself. So it came time for me to renew my lease on my vehicle, and I made a decision to get a luxury body versus a luxury vehicle.
My makeover is a term that we use to describe a combination of abdominal surgery, breast surgery, and liposuction. Breast surgery entails breast augmentation, breast lifts, or breast implants with a lift. Abdominal surgery includes most commonly an abdominoplasty or a tummy tuck and liposuction.
I wanted implants, and I also wanted my stomach fixed from surgeries, from having children. Seems like no matter how much weight I lost or gained, I just couldn't get my stomach the way I wanted.
She's very active now in running and in exercise and going to the gym, and she just couldn't firm up her lower abdominal area and her breast tissue. So no matter what she did, it wasn't going to be corrected with exercise and dieting. The plan that we chose for her, which included abdominoplasty and breast lift surgery with implants, was a plan that was tailored for her to help her with the issues she's had with her breasts and her abdomen.
After my procedures, I was actually able to go home. I didn't even stay a full day. Even having all 4 procedures done at the same time, I was able to go home like 12 hours after.
It's about a 2-week recovery of no activities. All they're doing is just walking around the house, and they're bent over. They need to be bent over to decrease the tension on their closure. After 2 weeks, they increase their activity level to mild activities. After 4 weeks, it's moderate, and after 6 weeks, they can fully engage in whatever activities they were doing prior to surgery.
I'm very pleased with the outcome, and I'm very comfortable. I was looking for something a little more natural, not so it looked like I was having procedures done, and he did exactly what I asked.
Great news for Southlake residents. Forest Park Medical Center in Southlake is just months away from opening, and it is a gorgeous facility.
Yeah, can you believe it? Forest Park Medical Center is now expanding and will continue to expand, but up next it is Southlake, and let's get an update on how Forest Park Medical Center Southlake looks.
Welcome to Forest Park Medical Center Southlake. It's coming to fruition. You can see it behind me here. You know, the best way to describe Forest Park Medical Center is imagine if you had physicians that could actually lead and build healthcare the way that they wanted it to be built. Lots of people build hospitals and design the systems in which we deliver care, but rarely are they physician-led and physician-driven the way that they are at Forest Park Medical Center. So as a physician-driven organization, a physician-envisioned organization, we deliver healthcare differently. And it's no more evident than looking at our buildings. You know, if you've not had a chance to walk through Dallas or walk through Frisco, and soon, in just a couple of months, be able to walk through Southlake, it's just different. It feels different. The idea is to take the healing environment to a different level. So we all know that really scientifically, the environment that we heal in makes a difference in how quickly we heal, how well we feel about the process, and that level is taken to its epitome in the Forest Park Medical Center facilities. And it's very, not just visual in the cosmetic appeal, but from a LEED certification standpoint. Our buildings are LEED certified, which means that we're really leading the industry in healthcare in terms of not just the look of the environment, but the healthiness of the environment. So it's a cleaner environment, essentially, and it's more environmentally sensitive. The whole idea that it is physician-led, it's how physicians would want healthcare delivered if they really could control 100% of it, and they never have been able to, but here they do. The people make all the difference. So the folks that are touching the patients are extremely customer service oriented. Hiring the right people makes all the difference in the world. There's going to be a couple of hundred people in the building, and we hand select and pick the best and brightest, both technically and from a compassion standpoint. Really looking forward to providing some leadership to the team that are innovative in bringing a different way of delivering healthcare to Texas and of course now here to Southlake.
Brothers Brock and Brady experienced multiple injuries due to sports. They credit Dr. Stephen Michelson, who got them back in the game. To find out more about this story, log on to bestdocsnetwork.com.
I was diagnosed with fibromyalgia 5 years ago, and I was experiencing chronic pain, exhaustion that wouldn't go away. I actually met Dr. Baek through his wife. Somehow the conversation that I had my fibromyalgia came up, and she said, my husband is doing a new study. It's called a PSTIM. And I was like, and she explained that it was for chronic pain, arthritis, fibromyalgia. It was FDA approved.
What is nice about PSTIM for patients is that there is very little prerequisites required to place this on. Outside of the contraindications of pregnancy or pacemaker, any candidate can benefit from PSTIM.
He installed it right there, and there was no drugs. I drove myself there, I drove myself home. Within 4 minutes of him putting it on, my headache started decreasing, and my pain started to ease up. And by that evening, I just felt great. And somebody said, you just look happy. And I was like, well, I'm not suffering from that chronic fatigue and that chronic pain.
There is a lot of skepticism initially with using PSTIM, but I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. So I took the initiative to talk to the distributor and made plans to be trained in the use, and that's how I became the first physician in Dallas to be licensed to use this device.
And my husband's gotten his wife back. My children have gotten their mom back. I don't complain. I'm happy. I feel great, and I'm really excited about it.
What I find rewarding about PSTIM is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
Forest Park Medical Center, of course, is one of the top medical centers in the entire Dallas-Fort Worth area, but also has a number of outstanding physicians that operate right here out of Forest Park Medical Center, like our next doctor. It's bariatric surgeon, Dr. James Davidson.
December the 4th, woke up at a girl's Christmas party and couldn't walk. Had to call my husband and say, baby, come and get me. I was in tears. Come and get me. You've got to take me and get a cane. I said, I've got to do something. I've got to do something. Went to the doctor to get some medicine for my knee, and she goes, you're looking at knee replacement. I'm going to have the bariatric surgery first, and if I have to have the knee surgery after that, I will.
Why does a gastric sleeve work? Well, first thing, it is a restrictive operation. You can't eat as much because you're removing 70–80% of the stomach. The good news is that you can eat just about everything. Certainly not as large at quantities because you'll feel full.
Yeah, it really happened fast. I attended the seminar, very informative. I came right to the office because I knew I wanted to do it. I came in and talked to the girls, and we started getting things set up. My first impression of Dr. Davidson was that he was very easy to talk to, very easy to understand, very confident. I trusted him just almost immediately.
Wanda's been is a typical success story for somebody who has a sleeve gastrectomy. She's lost about 100 pounds. Her BMI is now about 26. She can eat most everything she could before, not in quite as large a quantities. Wanda does not have reflux after a sleeve. Some people get reflux, but she doesn't.
I had my surgery a year ago, and I'm right at 100 pounds down. I feel awesome. It is the most wonderful gift I've ever given to myself.
Wanda's doing great. She's 1 year post-op this month. She's met all her goals. She does not have GERD. Her knees don't hurt as much, and she's taking her vitamins. She keeps doing these things of doing some exercise, taking her vitamins. We'd anticipate she should do just great for many more years.
Dr. Davidson changed my life. by offering this surgery to me. He wants you to take care of yourself. That's the awesome thing about Dr. Davidson. He wants you to be the best you can be. Dr. Davidson gave me the confidence it took to proceed with vertical sleeve gastrectomy.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center. Today's Ask the Doctor comes from Sarah. Sarah has a question for Dr. Richard Ha. If I do liposuction, will I gain more weight in other areas?
Liposuction is permanent removal of fat cells, but you're not removing all the fat cells in the area that you treat. So what liposuction does is give you a relative reduction of fat in an area relative to any place else. Let's just say that I have 100 fat cells in my tummy and 100 fat cells in my thigh, and I've taken away 50 of them through liposuction in my tummy. I have a new ratio. Instead of 1 to 1, it's now 0.5 to 1. Or it's twice as likely that I'm going to gain fat in the thighs as opposed to the tummy. So if you take in more calories, where is that weight going to be displaced, or where is that fat going to go? It's going to go preferentially to the thigh than to the tummy. Liposuction itself is not the reason that you're gaining weight or fat in one area. It's because you're taking in more calories.
Dr. Berlando's been my physician probably for 10 years. I just went to him originally to have a physician to go to, and then I started having physicals on a yearly basis. And about 4.5 years ago, on one of my routine physicals, Dr. Berlando discovered that my PSA was high. So he sent me to a urologist. They did some tests, including biopsy, and they discovered I had prostate cancer.
In Jane's particular case, there was a change in what's called the PSA velocity, the prostate-specific antigen blood work. What we were able to identify was there was a significant change in that from the previous study. And again, that's the importance of follow-up, so you can kind of compare that every year to year and a half to make sure that it's not going up too quickly. That was one of the key indicators that got him into the specialist to make the early diagnosis of prostate cancer. Early detection is really the key. That way we'll have better outcomes. The patient has a wider variety of different treatment plans to choose from that way, and it just works all around much better.
He's a good doctor. You can tell he's concerned. He spends time with you in the room. He doesn't just rush in and rush out. I believe is concerned about his patient's well-being, and he's just generally a good guy. He's knowledgeable, takes good care of me. He's concerned about my health.
We've had people that are feeling well, but they just come in just for a little routine exam and didn't realize it, but they are a walking time bomb. And again, explaining to them how aggressively this has to be dealt with from the get-go. Again, we're going to be with you every step of the way, making sure that whatever medication we use is not going to be harmful to you, and showing you the benefits of that. Again, making sure that that patient does follow up, so we've got good systems here in the office to make sure that we follow through with that.
If I hadn't visited Dr. Berlando, he hadn't been doing the physicals on a yearly basis, performing the PSAs, I wouldn't have known about it. Like I said, I would have probably found out about it very late in the game, which would have probably been too late to do anything for me.
That will do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Center, the top medical center in the entire Dallas-Fort Worth area.
As always, for more information on Forest Park Medical Center or any of the fine doctors that operate right here, log on to our website. It's bestdocsnetwork.com, and be sure to click on that Forest Park Medical Center tab.
So long, everyone. We will see you next week.